Thank you, Madam Speaker. I believe this bill is completely out of touch with the people of Colorado, who are screaming for help with affordability, public safety, the healthcare crisis and education crisis that I believe we're in. Providers are begging for help as they are sinking to keep their doors open. Hospitals barely operating above the red line. I think 22 out of the rural hospitals. And we worry about federal funding. We come up here all the time. It's almost like we're trying to poke the bear. One more bill, let's see what happens. One more bill, let's see if we can strip our federal funding. When our federal funding gets stripped, $9 billion from HICBUF will be gone. And then it doesn't matter about any of this anymore. We have then poked the bear. This will be, I believe this bill will be the nail in the coffin for our federal funding. We shall see, because all eyes are on us right now. I tried to pass an amendment for removing minors. And it's just so hypocritical to sit here and say that brains don't develop until 25. Oh, they can't have ammo, they can't have guns, you can't buy a beta fish at Petco till you're 18. You can't even get spray paint at Michael's until you're 18. But by golly, we are not carving out an amendment for those minors here. And as a healthcare worker, I am disgusted by the healthcare professionals that are enduring and almost uplifting this. Because I see it. I read the facts, I read the statistics, not the ones that I want to read. I dig and I dig and I dig. And I believe parents and children in this situation deserve much compassion. I think parents who seek transition for a child are victims of current medical practices, of the basic principles of do no harm, under the scare tactics of gender distress and suicidal ideation. Therefore, if those in the medical community will not offer sound medical advice, then it's up to the government to protect its citizens, and it must exercise it in the case where many well-intentioned parents are being misled to unwittingly support treatment that does not have a single ounce of scientific sound basis that will cause harm to their children. You're being lied to, parents. There are zero systematic reviews or evidence-based practice that affirms this for children. And it's being pushed by many in the medical community that fail to provide information on the high probability that beginning any step towards transition significantly increases continuation of more invasive and irreversible interventions. Research shows that over 90% of children who start with puberty blockers will go on to start cross-sex hormones. The path of puberty blockers followed by cross-sex hormones leads to permanent sterility and locking these children into lifelong medical dependency. We have a hospital here that starts children at the age of 8. It's on their website. You can read it. These are the facts. Do you think a child, the age of 8, can consent to sterility or loss of sexual function? We don't even think that they can own a gun until they're 21. The medical community fails to provide statistical data proving that unmedicalized gender distress causes an increase in suicide risk. In fact, it is quite the opposite. Hear me, please. From 2010 to 2022, 2 patients out of 15,000 on the wait list for gender identity development services committed suicide for a rate of 0.03%, versus studies that prove time and time again that people who have undergone cross-sex surgery are over 19 times more likely to die by suicide. This is why I ran an amendment, because I made a vow to the children in my district that I would protect them no matter what, that I would follow systematic reviews and evidence-based practice to follow what the research says, not what a little study here that doesn't follow evidence-based practice or a study here or a study of a couple kids here. I said I would search and I would do things that provide safety for children. And I added an amendment to carve children out of this. And I don't know if you guys are not talking to the people in your district, but overwhelmingly the people of Colorado do not support this for children. They do not support this. And they sure as heck don't support paying for it from their back pockets. They do not. And you're carving out the detransitioners, the ones that said, I was lied to, and I changed my body type, and I want to go back to my original sex, and we carved them out. We tried an amendment for those people as well that have had the courage, that have faced horrific things being said by them, about them, bullied, horrible things. And they came in here or they got on Zoom and they testified about what they had been put through, that their parents had been lied. If you don't affirm, your child will die. They didn't pass out informed consent because informed consent says that is not true. Most kids that go through puberty will revert back to their biological sex. Those are the facts. That is the truth. The children should have been carved out in this. It is not fair to continue to lie to parents and children. And I am passionate because no child deserves this without the facts. You give them the facts and the parents make that decision, all hands off. But when you're constantly lying to children and putting profit over their safety, and the advocacy groups and the activists continue to make billions of dollars. You want to talk about oligarchs? Look at the community that's doing this. The millions and billions of dollars they make on the backs of kids. So we either stand for protecting kids or we stand for nothing. Because the medical community that I'm a part of are lying to the children and the parents. And it disgusts me. Do no harm. I don't even think they know what that means anymore. When you become an adult, make adult decisions. That's what we say in this will. We pass bills. You can't drink alcohol until 21. You can't own a gun until 21. You need a 3-day waiting period. We pass those bills because we think it protects children. But this is a green light to not protect children. I don't understand the hypocrisy. You can't even go into Petco and get a betta fish until you're 18. But an 8-year-old can decide to cut off healthy body parts and go on lifelong sterility drugs that are non-FDA approved. What are we doing? What are we saying to the children of Colorado and to their parents that deserve informed consent? After they have informed consent, that is their right to choose. But we can't keep lying and telling them their kids are going to commit suicide because that is not facts. I have a 15,000-person study. 2 children dead, which is horrible. I never want to hear that. 2 out of 15,000 that were waiting over a year to 2 years for gender-affirming care. It is statistically a lie to these children, and it is wrong to lie to these parents who have been told the only way to save their children is to go down this path, which is a lie. And if you told me, I'd probably do it because I'd want to save my kids. It is not fair to the children and the parents in this community that are scared and confused to lie to them. And they should have been carved out. And it's not fair to people like me to try to get me to pay for this nonsense. And the people in my districts and the people in my community, we will not do it. I will not pay to remove healthy body parts off of a child. We're against that in most African countries. But we applaud it here? No, absolutely not. The taxpayers should not be forced to pay for procedures they disagree with when they are struggling to keep the lights on. We talk about all the time, uninsured, underinsured. 1 out of 5 Coloradans don't even have health care. And we're gonna pay for elective procedures when most of us in Colorado don't even agree with this? I'm at a loss. I'm at a loss. On the last day of session, I'm at a loss. We say we want to protect the kids, and then we pull one study that backs us up. There's a reason that countries are stopping this. There's a reason that children's hospitals all over the country in this United States of America are stopping this. For children, they're saying pause. Kids are being hurt with lifelong sterility and mutilation, and they can't come back. That's why they're 19 times more likely to commit suicide after they undergo the surgery. Those are the facts. That is the blood on our hands. Adults have the autonomy to make those choices. You can understand, if you go through this, you might not be able to breastfeed or have children. Make those informed decisions.
Representative Bradley, you have 50 seconds remaining.
Thank you, Madam Speaker. Do that. That's why we don't put guns in kids' hands. That's what you say. They're not mature enough to own one. They're not mature enough to make these decisions. And I will be damned if I'm going to pay for it. And I will be sure to make sure my constituents know what we're passing here. When they can't afford bread and eggs, that we're going to fund increased premiums for elective procedures. Vote no on this bill.